All right, so we're back, and this time we're diving into Trump's potential picks for his administration.
Yeah.
And this one is, well, let's just say it's a head scratcher. So get this, Dr. Oz. Yeah, that Dr. Oz. You know, heart surgeon TV personality. He might be in line to lead the Centers for Medicare and Medicaid Services, CMS for short.
Wow, yeah, diving right into the deep end with this one. It's definitely a surprising choice, to say the least. CMS is a huge agency. We're talking about the organization that handles Medicare and Medicaid and the Affordable Care Act marketplaces. It basically dictates how healthcare works for over 150 million Americans.
Yeah, that's a huge responsibility.
Yeah.
And honestly, it's a little unsettling to think about someone with Dr. Oz's background at the helm.
Yeah.
And his history of, well, let's just say colorful opinion.
Okay, I see what you mean. What specifically about Dr. Oz's past makes you say that?
Well, just think about it for a second. He's been criticized for promoting miracle weight loss cures on his show, and once even suggested hydroxychloroquine for COVID, which we know turned out to be ineffective.
Yeah.
And those are just a couple of examples.
Right. Those stances did draw a lot of criticism from the medical community.
Yeah.
There were definitely concerns about a pattern of endorsing ideas that lacked scientific backing.
Exactly. So how does someone with that kind of baggage even get on Trump's radar for a position like this?
Well, remember, Dr. Oz made a foray into politics back in 2022 when he ran for a Senate seat in Pennsylvania.
All right. The race against John Fetterman. Didn't go so well for him, though, did it?
No, no, it didn't. He ended up losing to Fetterman. But despite that loss, Trump clearly sees something in him. In his statement about the potential nomination, he praised Dr. Oz's TV fame and his desire to take on the illness industrial complex. Sounds like he wants a disruptor, someone who can shake things up.
Okay, but is being a TV personality and a disruptor enough to qualify someone for such a critical role? You know, managing one of the most complex and politically charged sectors of the American government.
Yeah, it's certainly a striking contrast to the typical background of past CMS administrators who usually have deep experience in health insurance policy or government.
Yeah, this feels more about aligning with Trump's populist message of challenging the establishment than choosing someone based on actual qualifications.
That's a valid point. And it's something that's raised a lot of eyebrows, not just among the public, but also within the Senate.
Speaking of the Senate, Senator Patty Murray, who used to lead the Senate Health Committee, she didn't hold back in expressing her concerns. She directly criticized Dr. Oz's lack of qualifications and his history of promoting what she called pseudoscience.
It's a valid criticism, but beyond those concerns, I think it's crucial to understand Dr. Oz's stance on Medicare itself. He co-wrote an opinion piece for Forbes back in 2020, advocating for a pretty radical approach.
Okay, let's unpack this, because I have a feeling this is where things get really interesting. What exactly was he proposing?
In a nutshell, he argued for a system of universal health coverage, where everyone who isn't covered by Medicaid would be enrolled in a private Medicare Advantage plan, funded through a 20% payroll tax.
Hold on, a 20% payroll tax. That's a huge change. What about employer health coverage and the existing government Medicare program? Would they be gone?
That's right. He proposed doing away with both. And this is where it gets fascinating, because this approach aligns with some Medicare for All proposals from Democrats. But unlike those proposals, Dr. Oz's vision relies heavily on private insurers. Even within his own party, his stance could be seen as controversial.
So we have a potential CMS administrator who has a history of promoting questionable medical advice, a lack of relevant experience, and a radical vision for Medicare.
And don't forget, we haven't even touched on his potential approach to Medicaid and the Affordable Care Act.
Right. There are so many unknowns here. Okay, so we've established that Dr. Oz's potential nomination is raising a lot of eyebrows. But let's dive a little deeper into those unknowns you mentioned, specifically his stance on Medicaid and the Affordable Care Act. Where might he stand on those?
Well, that's the million-dollar question, isn't it? And it's particularly important given that we're talking about a potential second Trump administration. We have to consider his previous attempts to repeal and replace the Affordable Care Act.
Right, and even though those attempts ultimately failed, it suggests that healthcare reform would likely be high on the agenda for a second Trump term.
Exactly. So the question becomes, where does Dr. Oz fit into all of this? Would he be on board with efforts to dismantle the Affordable Care Act, or would he chart a different course?
Well, it's a little murky. I know he's expressed support for the law's goal of expanding health insurance coverage. But he's also been critical of its implementation, calling it a government takeover of healthcare.
Yeah, he's walking a tightrope for sure, acknowledging the positive aspects while also aligning himself with the Republican critique. But that makes it incredibly difficult to predict how he might approach the Affordable Care Act if he were actually in charge of CMS.
Would he try to work within the existing framework to make changes, or would he push for more radical reforms? I mean, we've already seen that he's not afraid to shake things up when it comes to Medicare.
And that's what makes this so fascinating. It's not just about Dr. Oz's individual views, it's about how those views might intersect with the broader political landscape and Trump's own healthcare agenda.
It feels like we're trying to solve a complex equation with half the variables missing.
That's a great analogy. And unfortunately, when it comes to politics, that's often the case. But even though we can't predict the future, I think we can identify some key areas to watch.
Okay, so if our listeners trying to make sense of all this, what should they be paying attention to?
Well, first and foremost, any changes to eligibility requirements or benefits for Medicare, Medicaid, or the Affordable Care Act. If funding is cut or eligibility is tightened, that could have a significant impact on millions of Americans.
That's a sobering thought.
Absolutely. Another area to watch is any effort to increase the role of private insurers within these programs. Remember, Dr. Oz's proposal for Medicare involved a significant shift towards private Medicare Advantage plans.
And that raises all sorts of questions about cost, quality of care, and patient choice.
Precisely. And finally, keep an eye on any signals about the overall direction of healthcare policy. Will the focus be on reducing costs, expanding coverage, or something else entirely?
It feels like we're at a crossroads, and the choices made by the next administration, particularly when it comes to CMS, could have ripple effects for years to come.
I think that's a really insightful way to put it. The stakes are high, and the uncertainty is palpable.
Okay, so we've covered a lot of ground here, and I think it's fair to say that Dr. Oz's potential nomination is generating more questions than answers.
Yeah.
But what does this mean for the average American who relies on these programs? What can they do if they're feeling overwhelmed or concerned?
That's a great question, and I think the first and most important thing is to stay informed. Follow the news, read up on the issues, and try to understand the potential implications of different policy decisions.
Knowledge is power, right?
Absolutely. And it's not just about national politics. A lot of healthcare policy is implemented at the state level, especially when it comes to Medicaid. So paying attention to local politics is crucial.
You know, it's easy to feel helpless in the face of these big, complex issues, but you're reminding me that we're not powerless. We can make our voices heard.
Exactly. Reach out to your elected officials, join advocacy groups, and engage in conversations about these issues.
Because at the end of the day, this is about our health, our well-being, and our future.
Well said. And speaking of engaging in conversations, I'm curious to hear what our listeners think.
Yes. Let's open it up to our audience. What are your thoughts on Dr. Oz potentially leading CMS? What are your biggest concerns or hopes for the future of American healthcare? Share your thoughts in the comments below, and let's keep this conversation going. And be sure to subscribe to the channel for more deep dives into timely and important topics just like this one. We'll be back soon with another episode, so stay tuned.